Thank you for joining the first of our monthly Alberta Healthcare Billing webinars, Primary Care Matters. My name is Dawn Osland, and I will be your host today. I have about 20 years experience working in the Alberta Health, with Alberta Healthcare Billing across the industry here in the province of Alberta. Over that time, I have fell in love with Alberta Healthcare Billing and the schedule of medical benefits. In the first 5 years of my career, I made every mistake imaginable when it came to Alberta healthcare billing. My rejection rates were through the roof, and I kept banging my head off the desk, trying to figure out how to make this a better situation and to reduce my rejections and make the system just flow a little bit easier. So, since then, I have learned to maneuver through the schedule of medical benefits quite effectively. And the reason why I wanted to start doing these billing webinars monthly for the healthcare providers and the physicians here in the province is because I want to be able to share all the tips and tricks that I've learned throughout the years. Because I know Alberta healthcare billing can be stressful at times. I know the schedule of medical benefits can read a little bit like 1980s version of stereo instructions. So I'm hoping over the next few months, if you continue to join me, I'm hoping that I can help to clarify and make the Alberta healthcare billing a little less muddy and confusing for you. So I'm going to jump right in here today. I'm just going to share my screen with you. Whoops, give me 1 second here. Bear with me. And we'll get started. Whoops. Sorry, just give me 1 second, guys. Great. And again, thank you for joining us today. Just to go over a couple of items that we will be reviewing today over the webinar, we're going to talk a little bit about the physician resource guide, the schedule of medical benefits, some of the amazing resources that the Alberta Medical Association offers, like the Fee Navigator, as well as the different billing resources that are on their website. I'm also going to go over a few different just beginner basic codes about billing multiple injections at one encounter, different minor procedures that can be combined with your 03.03A, and as well as different excluded services under out-of-province billing. Okay, well, we're going to start today talking about the Alberta Resource Guide. Just to let everybody know, I will be sharing in an email following by the end of business day today, where you will get links to each and every one of these resources I'm sharing here with you today. So that way you don't have to worry about trying to write down all the web addresses, etc., throughout the presentation. I will be sending you a follow-up email with all the links and the information, so that way you can have it and save it to your own individual desktops. But we'll start here at the Physician's Resource Guide. This is a very valuable resource. It is kind of the first place to start in regards to looking at your Alberta healthcare basics. It covers a wide variety of different information that can be very helpful in a clinic setting as well as to individual physicians. It covers things that are required for submitting claims to Alberta Healthcare, what your mandatory claim requirements are, what portions have to be filled out of the bill in order for it to be accepted by Alberta Healthcare. It goes in and it does discuss about reciprocal billing, which is when you're billing to other provinces that do pay for the medical visits to a family clinic, how that works, what's covered, what's not covered. One thing to note is that Quebec does not participate in our reciprocal billing with the other provinces in Canada. So they are the one province where you would not be able to bill directly to their province for that. So a couple of really interesting things in the physician resource guides that I find I know myself, I've gotten confused in the past about that. I just wanted to offer a little bit of clarity about a couple of things that you can find in the guide. For example, your practitioner request forms. This is a form that you would be using when you're registering a doctor for the very first time. For example, a brand new resident that just graduated from school, or let's say you have brought in a new physician, an international medical graduate that has never applied for a prac ID before. That would be the form that would be best to use for getting them to apply for their practitioner request for the first time. And that form also includes their BA number. Another really good form to be aware of is your facility registration form. This form would be used, for example, when you have a brand new clinic that you have just opened, that you are taking over, that you are changing in some form, that's when you would use a facility registration form for a brand new clinic that has been open. So that way you can register the facility with Alberta Health Service or with Alberta Healthcare in order to be able to bill under that facility. One of the most used forms that you will find information about in the Alberta Physician Resource Guide is your business arrangement number form. This is the form that is used when in two different circumstances. When you have physicians joining your clinic, you would use it, for example, if they are joining your clinic as a panel physician to where they would be seeing a panel of patients, they would fill out a BA arrangement form. This form is also used, for example, if you have a locum physician that is joining your clinic practice as well. It is a live document, so I do recommend that does change a PDF live document that does change depending on the type of request, especially in the business arrangement form that you are requesting at that time. So I do recommend that you always check back to the live document on the website, which I will be sending you the link out to, just to make sure that you're using the most up-to-date form, because we all know we don't like any delays when we're submitting our forms into Alberta Health in order to get this set up for physicians, and sometimes using an outdated form can end up delaying them processing that application. Okay, there is also something really interesting that I came across in the Physician Resource Guides that I'm not 100% sure everybody's aware of. I know we all run into problems sometimes with rejections in regards to people having invalid health care. So I wanted to let everybody know today about the IVR system. It's an interactive voice response system that can be called 24 hours a day to be able to check on whether or not your patient's Alberta healthcare is valid. If you find that you are having a high level of rejections due to invalid healthcare, this would be a great opportunity to work this process, possibly, or work calling in to verify the Alberta healthcare number into your process within your reception, your MOA, interacting with the patient type of thing, especially if you find you're getting a high volume. And again, this number can be accessed 24 hours a day, 7 days a week, except for during their maintenance times on Sunday evenings. I find this quite a valuable tool and I highly recommend it. Okay, now I have a question for everybody out there. I am going to be releasing a poll here because I would like to, whoops, sorry guys. I would like to know, when was the last time that everybody that's on the call here today has reviewed the schedule of medical benefits? So I am just going to release out a poll here for you. Bear with me here 1 second. Technology is not liking me much today. And actually, we will come back to that because for some reason it's not popping up. So let's get back to our presentation. Okay, sorry about that, everybody. Bear with me. My computer just doesn't seem to like me today. I'm sure everybody can understand that. Sorry, everyone. Okay, great. Can everybody see the slideshow behind me? If I can just get a thumbs up from somebody, that would be great. Michelle, can you give me a thumbs up if you can see it? Wonderful, thank you. Okay, so next resource we're going to jump into talking about is the schedule of medical benefits. I know that this can be a little overwhelming when you look at it. I myself, being that I'm experienced with Alberta healthcare billing, I do love the schedule of medical benefits, but to somebody that's never kind of interacted with it before, it can be a little daunting. It does read like 1980s stereo instructions, unfortunately, and it is a 1,235 page book that is broken down into these five different sections. Okay, so one of the first sections is called the explanatory code lists. I know this doesn't seem very straightforward with what all these mean, so I'm going to kind of translate it into some common terms. What your explanatory code list is it is a list of all your rejection codes. So in there would list all your different rejection codes that could possibly be coming back on your Alberta healthcare claims. And this would be a great reference to look to see what that rejection code is and kind of what the long definition of it is and possibly how to solve it. I find that the explanatory code list, which I like to call the rejection codes, is something that I do have off to the side of my desk and I do reference really quite frequently. The next portion of the book is called the fee modifier definitions. This is a great portion of the Schedule of Medical Benefits because it does lay out for you all the different fee modifiers that can be applied to the different base codes for billing to Alberta Healthcare. For example, the body mass index, the CMGP, your complex visits on top of your 03.03As, as well as different age modifiers. There in this book does define what the age what the modifier is and how it can be applied. So if it's great to review those quite frequently because you may not be actually applying something like the BMI in your actual daily practice in your clinic and could be losing out on optimizing those bills. So it is good to review that and take a peek at it for ways that you can optimize. The medical price list portion of it, this is a little bit of a not day-to-day use one. What it gives you is a list of all the base rates for each billing codes in the Schedule of Medical Benefits, and then how that base rate changes based on the skill and the specialty of the physician utilizing the codes. It's not a portion of the book that I use too frequently unless I'm being asked by a client or a clinic in regards to what is a pay difference if they had a different skill code. For example, if they were a family physician opposed to being an ophthalmologist working as a family physician would be an example. The next portion of the book, the medical procedure list. This is what I call the billing Bible portion of the Schedule of Medical Benefits. It lists all of the Alberta healthcare billing codes and the rules and regulations for using said codes. Some of those rules and regulations are short and simple. Unfortunately, some of them can be rather cumbersome and can be rather long and complex and come with sometimes some rules that seem to contraindicate each other and at times feels like you need a secret decoder ring in order to explain. Now, the last portion of the book, the medical governing rules. That portion of the book links to the governing rules of each code. Now, that would be more explainable in regards to when you are accessing the the Alberta Medical Association Fee Navigator. When you are accessing that site, and you are punching in your different codes, for example, your 03.03A, you will notice as you scroll down to the bottom of the information, there is a whole list of different governing rules by a number type. Now, if you're ever wondering about some of those rules and how they interact, the best way to look at it is through the medical governing rules portion of the Schedule of Medical Benefits, and that'll help to link it all together. All of these pieces work together when it's your physician resource guide as well as your Schedule of Medical Benefits. None of these resources really work in silo from each other. A lot of them work in concert with each other and build off of each other. Okay, now I'm going to talk about we're going to go over just a few different billing codes that I'm not sure that you're aware of before I give you a little bit of tour of the new Alberta Medical Association's website and some of their different billing tools and resources that are available to you as well. But first, I want to talk to you about multiple injections at the same encounter. I know we've all came in during flu season time where we have a patient come in and let's say they're there for their diabetes check, but they're also there to get their flu vaccine and, their B12. I know that I've seen in the past or a lot of times that these multiple injections don't get billed at the same encounter if they are being given more than one, but they actually can be. You can give more than one injection at a time by just increasing the call field on your actual bill within each of your EMRs. Anything beyond 2 injections in a specific visit, though, will require additional text to explain why. Okay, another I'd like to talk to you guys about are visits that can be combined with minor procedures and with the same diagnostic code. I know that we've all probably ran into situations with rejections where they get rejected because we've combined a 03.03A with a procedure code and use the same diagnostic code. This is a list of the the procedure codes that are combinable with your 03.03A visit, utilizing both the same diagnostic code for both claims. And that is, of course, your injections, incision and drainage of an abscess or hematoma, a removal of sebaceous cyst, removal or excision, first lesion, cryotherapy for treatment of warts, varicose vein single injections, removal of an IUD, Botox for migraines, but that's only if the patient does have a history of migraines and has not had that same procedure done within the last 12 weeks. Another one is a joint injection in the hip or in other joints, as well as a removal of a sebaceous cyst, which I believe I have on there twice. So those are items that you can combine with your 03.03A and the same diagnostic code, and both will be paid at full price. Okay, I want to talk a little bit about some excluded services from reciprocal billing for out of province, because not everybody is fully aware that some services aren't billable and don't really always find out until that rejection comes back. Routine periodic health exams. At times, sometimes the other provinces will reject your 03.03A, your physical exams for out-of-province healthcare. 9 times out of 10, I find they do get paid, but I have found that there is a small percentage of them that do end up coming back rejected. So if you do find that happens, sometimes transitioning it to a 03.03A with the applicable CMGP modifiers is a good alternative to be able to bill for that. Another out-of-province bill that will not get paid is anything telemedicine related. So your virtual care. So your 03.03 CVs, as well as your 08.19 CWs. Those will not pay for out-of-province as well. Any surgeries for reversal of sterilization, which there's also some limitations for that under Alberta healthcare as well. And of course, any services that are provided to Canadian Forces, that's WCB related, Veterans Affairs, or through correction services. There's one other thing that came out here at the beginning of this year that I really wanted to highlight. And it's this, we hear it's connected with a lot of different billing codes. It's called major portion thereof. I'm sure you've heard that said, where the physician can bill in 15-minute increments or the major portion thereof. Well, what does that mean? Well, what that means is that they would have to have spent 8 minutes with that patient out of that 15-minute interval. For example, a mental health visit, the patient comes in, the patient was scheduled for a 15-minute visit, and the doctor only seen them for, let's say, between 8 and 10 minutes of that 15-minute visit. Before the beginning of this year, you would not have qualified for a full 1 unit, but under the new major portion thereof, you would actually qualify for a full 1 unit of the 08.19G billing code. Another good example would be, let's say you spent 23 minutes with the patient, opposed to what used to be 30. That is billable as 2 units under the 08.19G or the 08.19CW, or any of the codes that based on the patient time of 15 minutes interactions with the physician or major portion thereof. So I would really recommend everybody take a look at the different codes that you are standardly using in your clinic practice, and do any of them have that major portion thereof? It's a really good idea to relate that information of those codes back to those physicians, because they may be still billing thinking that it has to be that full 15 minutes or that full amount of time has to pass when that rule has actually changed at the beginning of this year. Another amazing resource that I highly recommend is Alberta Health Bulletins. What Alberta Health does is it puts out regular and medical bulletins quite frequently whenever there is a change to the system. I myself, I check this website quite frequently, probably once a week or once every 2 weeks at the longest, just because it seems to be the one place when they are shooting out information immediately when there seems to be a change coming to a claim, when there seems to be an update to a billing code that we're unaware of, if there's been an add of a billing code, if they tend to let us know about the changes coming to the schedule of medical benefits every year in April before they happen. So I highly recommend this is something that you kind of put on your desktop and you check quite frequently. So that way you are aware of changes coming out and can relay them to your clinic staff, your billing support staff, and your physicians within your clinic as soon as they come apparent. Because there's nothing worse than finding out that you could have actually been billing more efficiently and more optimizingly for a certain billing code and had no idea that it actually had changed 3 months prior. So I highly recommend checking this out quite frequently. Okay, now I'm going to go and I'm going to share my screen and show you a little bit about some of the wonderful things on the Alberta Healthcare website. Okay, just give me 1 second here and we'll. Okay, can everybody see the website in behind me? If I can just get a thumbs up, make sure everybody can see. Perfect. Okay, well, this is the Alberta Medical Association website. It's an absolutely amazing resource that you can access where you can find different information about all kinds of different things related to primary care practice here in Alberta. But what I'm going to draw your attention to is 2 areas. You can either through up here under practice, you can reach billing support, or you can scroll down to the bottom of the page here. And under their quick links, you can also get what's called billing help. Both take you to the same place. So let's click on and see what we can see. Under the billing support page here, you're going to find there's a lot of valuable resources that the Alberta Medical Association offers to primary care physicians throughout the province. One of the amazing things that they offer are billing seminars. You would need to contact them to find out more information based on what your needs are and whether you're looking for in-person or online help with that. Some of their other resources here are the AMA Fee Navigator, as well as the AMA's Billing Corner, their billing tips, and again, what we spoke to about earlier, the Alberta Health Physician Resource Guide. Now, the Billing Corner is quite interesting. I'm going to take you to that. Here in the Billing Corner, you are going to find that this is where they post any updated newsletters that they have put out. As you can see here in 2024, we've had one in January, February, and April. The one in January speaks about, it's either January or February, speaks about good faith claims. I'm not sure if everybody is aware, but there was an opportunity to be able to back bill for good faith claims that actually had not been paid up in, I believe it was the last 18 months. So I highly recommend checking this out, especially if you have not billed any of your good faith claims and are having some that are coming back as being rejected. As well as the April Billing Corner one gives a great update about the changes that had happened in this year's update to the schedule of medical benefits. So it's a great place to check out. Unfortunately, between 2020 and 2024, there wasn't too much information, but I'm really glad to see that they're back posting up. Okay. And I'm going to take you to the billing tips here. The billing tips page here has a lot of great little cheat sheets. I know they did just update their website last week. They just refreshed it. So I know I was not able to, as of last night, to be able to click in to show you each of these, to show you some of the different codes. I'm hoping that'll be fixed for them soon. But it does go into different things about after hours work, callbacks, forms, for example, green sleeves. If you find you're filling out, there is no Alberta Healthcare billing code currently for green sleeves. But what they do recommend is if you are doing that for your patient care, is that can be included in your CMGP modifier for time spent and preparing for that visit. They have some information about injections, if you're claiming the right injections, multiple injections, Botox, as well as the different codes for using nasal flip, nasal flu mist, or for the pneumonia injections, as well as lacerations. If you find you're doing a lot of lacerations in the clinics, I do recommend that you do check out the rules and regulations for the lacerations. It's a bit of a mathematical formula based on skin layers and depth and length of the actual laceration that you are suturing. So I do recommend checking out those billing codes because you may not be fully billing for those certain areas at this time. As well as there's some great information here about all your different modifiers that can be utilized on your different patient visits. There's some information about record keeping, as well as telephone calls, uninsured services, as well as some other key points under visit services like family conferences, when and where that's applicable to use them and how to use them. I will throw out a note here. If you're doing a family conference, a 03.05 JB, and you find you're getting them rejected because of an encounter number, then I would recommend putting it as a second encounter. I have seen a lot of rejections come in because it says that the claim is not an appropriate encounter number. And 9 times out of 10, that just means that you need to change the encounter number to 2 instead of 1 in order for both claims to be payable for the same visit time. There's also great information here about major portion thereof billing, as we were speaking of earlier, as well as some different toolboxes if you need some information on substance use disorders and visits with minor procedures. There's also some great tips with WCB. If you find you're struggling with some WCB billing, or you're not 100% sure about what is different between billing to Alberta Healthcare opposed to a billing to WCB, these tip sheets can be really helpful with helping to answer those questions and how to deal with a rejected claim, specifically a code 21. If you find that you're getting Alberta Healthcare billings coming back that are being rejected and they have the rejection code of a 21, I highly recommend that you look into how to deal with resubmitting that to WCB for full payment, including an administrative charge for that. So the AMA website is a great place to be able to check out for your different resources. I'll give you a little bit of a look here of what the page looks like that the health bulletins come on. You'll notice as I'm scrolling down here under health bulletins, under archives, you're going to see both general and medical. I highly recommend checking out both of them because general and medical can be a little bit different. For example, here, the general one, we'll just give it a moment here to open. Ends up listing all the different things that have happened recently. And for example, rejected claims, this is addressing the information in regards to your good faith claims. There has been a registry discount on drivers' medical examinations. No, that does not mean a discount when they're paying for it at the clinic. That means that I believe seniors are receiving a discount when they're paying for the registry services at the registry services offices for the driver's medical. Back in April, I'm not sure if you're aware, there was a problem with Alberta Healthcare claims payments being processed for a week or two. This is where they immediately updated and let us know exactly what had happened, why it happened, and when it would be corrected. So it is a great place. If you notice something's a little off with your Alberta Healthcare billing, check and see, did something maybe happen this week I'm not aware of? Oh, we already looked at that one. Okay, now I'll take you back. Okay, perfect. We are going to be having additional webinars starting once a month. They're usually going to be the fourth Thursday of every month. Our next one is going to be on September 26th, where we're really going to be digging into the rules and regulations around your 03.03A versus your 03.04A and how this can impact your panel payments. As well as on October 24th, we are going to be hosting a specialized panel on location. Can't say where yet, but more information coming soon, where we're going to be discussing things like the panel equation and the BCP payments, the business cost payments that come out on top of your Alberta Healthcare billing. Now, before we open up the floor to questions, I am just going to play you a message from our sponsor.
Are you struggling with billing to Alberta Healthcare for your time-based tasks? Did you know that you are leaving up to 30% of your patient activities unbilled? After switching to the CMGP calculator, you will no longer have to mentally calculate the time you spend on administrative tasks related to your patient visits. We designed the CMGP calculator with efficiency and simplicity in mind, making it accessible where and when you need it. Sign up for your free trial today at www.cmgpcalculator.ca. Are you struggling with billing? Are you struggling?
Okay, thank you. That was just a message from our sponsor. If you would like to know more about the CMGP calculator, please visit their website at cmgpcalculator.ca. Bear with me, I'm a little tongue-tied here today. Or you can email me directly at dawn@cmgpcalculator.ca or call me directly. We also offer virtual and live in-clinic demos for anybody who might be interested. Okay, and if you have any Alberta healthcare billing questions, please email them in at any time to info@cmgpcalculator.ca, and we guarantee we will answer you by the end of the next business day. And we won't just send you to a page in the schedule of the medical benefits. We'll actually help walk you through what your question is and help you with the solution. Even if that means that we need to book a quick virtual meeting in order to help walk you through and help you resolve any issues that you are having with your billing. And now I would like to throw it out to everybody if you have any questions. So give you guys a chance to ask. Ask about any problems that you're currently having right now with your Alberta healthcare billings. Please feel free to put them in the chat or to come off of mute and ask your questions live as well. Yes, I'm seeing what you're saying. If I can flip back to the procedure slides, I sure can. Give me 1 second here. And I also will be sending this out to all of you in your follow-up email, so you will get a copy of all of all this information that I shared with you. The slides won't be shared, but the information on the slides will be coming directly out to you. So just so I can send it to you in a nicer format. And just so everybody is aware, all of this information has been taken directly out of the Schedule of Medical Benefits or the Alberta Medical Association. So this is information that I did not come up with on my own, that I have just from the different resources that are out there. Okay, let's see what else we have here. Questions? Okay, if you do a mental health consult for 6 minutes and bill a 08.19 for you, you must put the time of the consult. Actually, for any of your visits, you actually should be recording your start and stop time. A lot of times in your standard EMRs, it tends to track it somewhat, but rule of thumb is I would recommend tracking your start and stop times. In regards to billing for your mental health visits, those codes, the 08.19G or the CW, are considered patient interaction only. It doesn't take into consideration any pre or post work you have to do for that, which is very unfortunate because as they are mental health visits, I'm sure there is a lot of additional work to be done. But it only does let you bill for the actual time that was spent with the patients. So you would need to hit that 8-minute mark in order to use one unit for the 08.19, either CW or G. I'm hoping that's something in the future that we do see a change come to, only because whether somebody's coming in because they have bronchitis or they're coming in related to a mental health appointment, both appointments take pre and post time to do. So I'm hoping that we do see some changes in the future to realize that just because it's a mental health appointment doesn't mean that you should not be compensated for the time that you're spending prior and post. Okay, any other questions out there? Okay, well, since we don't seem to have, oh, here we do another one. If you do a pap smear, okay. Yes, yes, you can. Yes, you can, because your PAP is on top of your additional visit. If a patient's coming in to see, you can combine both your 03.03A and your PAP smear. Of course you can. And I would highly recommend it. Otherwise, you're kind of shortchanging yourself just for that procedure. I love that question. Thank you, Yolanda, for the question in regards to an office visit with the nursing code. That is the 03.05JA. That is a very, very complex question that is not a simple answer to. There is different ways you can use your 03.05JA, and we will be doing a longer session on that here in the fall just because it is such a complex issue. But it's not a simple answer because it has a lot to do with what your clinic workflows are, how you're structuring your nurses' interactions with your physicians. Are they getting consult time? Are they doing kind of report outs of their patients? That type of thing. So it is a little bit deeper of a conversation. And we will be having a session on that here in the next couple of months so we can really dive deep into it, to which we'll be pulling in some different billing experts that have years of experience using that code from the different or from some of the different nursing areas. So that way we can really kind of dive into some of the best practices that are out there. But if you'd like to speak more about that one-on-one, please feel free to reach out to me and we can kind of dig into that a little bit deeper. Well, I'll give it a few more minutes here and see if anybody else has any other questions. And just to remind everybody, we'll be having another one in October. So please feel free to sign up for that and spread the information out there, as well as please feel free to submit to me, not just questions that you might be having, but some ideas on some different sessions that you might like to hear about, some things that you're having troubles with that we could possibly turn into a session. We are also going to be looking to do a lot more of our webinars on locations at clinics and different facilities throughout the province of Alberta. So if you're interested in hosting us for one of the webinars, or if any of the physicians are interested in being on any of our panels, please also reach out to me at dawn@cmgpcalculator.ca, and we can definitely hook you up with that. What you bill wart treatment treated topical therapy in the office. Bear with me a second. If it's cryotherapy using liquid nitrogen, I use the 98.12L. And yes, that is combinable with your 03.03A. Will I be discussing ER surgical billings in the future? Yes, that is something that we will be starting to do in the future. It just will be closer to the Christmas area because I myself am an expert in family practice billing, but we are bringing on some people who are experts in the ER as well as surgical billing who will be joining our team, and we will be adding webinars in those areas as well. If you use something differently in regards to cryotherapy for warts, in regards to that, that I would have to, Iona, I would have to look into. I believe there is, but not off the top of my head. So let me look into that and I will let you know about that. Okay, bear with me here for the two codes, a scenario where the patient declines after transfer to another physician. The visit is longer than the does not qualify. Can you bill JC? Yes, I believe you can. Joanne, let me double check that and I will send you an email right after our session here today. I always like to double check in the book just to make sure if I'm not 100% sure. So that way I make sure I give you the right answer. Long-term care, yes, we've had a lot of interest in regards to long-term care, home visits, those difference. avenues for billing. So yes, we will be adding those to the docket. If you could please, if there's stuff in regards to the long-term care that you're struggling with, or in surgical or in the ER billing that was being mentioned, please feel free to send those questions as well into us, because I will forward them to the other people on our team and we will get you the answer and the support that you need. Okay, wonderful. Well, I won't keep you guys any longer. I'll let you give you back a few more minutes of your lunch hour, so that way you can have a little bit of time for yourself before I'm sure everybody's afternoons are starting with patients and clinical obligations. So please, again, thank you very much for joining us. And I'm so excited that we're able to meet like this and to be able to start sharing some of the different information that I've learned over the last 20 years with everybody in the province of Alberta, and to be able to support physicians so that way they don't feel as in the dark when it comes to dealing with Alberta Health Service codes. And I know that there's a lot of questions in the industry right now and a lot of confusion because there's different pay models and there's different options that are coming down the line for everybody. We want all the physicians in the province to know that we are going to be there to support them. Regardless of what pay model they decide to go on, we will help to unmuddy the waters and make things clear for whatever questions that they may have coming up. So please know that we're here to help. Please feel free to reach out at any time, and we will definitely get back to you, like I mentioned earlier, by the end of the next business day, because usually when we're asking a question related to our accounts receivable in our medical clinics, we need to know the answer immediately, not a week, 2, 3 weeks down the road when it could possibly be forgotten or slides off the side of the desk. So please feel free, again, reach out at info@cmgpcalculator.ca. And everybody have an absolutely wonderful Thursday, and I will see you next month.